How do you prevent benign prostate enlargement? Is benign prostatic hyperplasia serious? Benign prostatic hyperplasia, BPH, is a relatively common condition found in older men. It can cause urinary incontinence, weak streams, or recurrent urinary tract infections. If the condition is severe enough, urinary catheterization may be needed to relieve symptoms. Rarely, it can lead to irreversible renal damage. Symptoms of BPH should be monitored closely by a healthcare provider. An initial assessment should include a digital rectal examination and urinalysis. Men with urinary hematuria or persistent urinary incontinence should also undergo evaluation for bladder cancer. Patients with palpable nodules or induration should also be referred for assessment. Benign prostatic hyperplasia can be treated by a urologist. This medical professional specializes in the urinary system and will evaluate your symptoms and medical history. They may perform a physical exam and a digital rectal exam, which involves inserting a gloved finger into the rectum. This exam enables the doctor to examine the prostate surface and detect hard areas that may be cancer. Can benign prostatic hyperplasia be cured? Benign prostatic hyperplasia is a condition where the prostate grows larger than normal. The prostate is located in the front of the rectum, beneath the bladder, and surrounds a small portion of the urethra, the tube that carries urine and sperm out of the body. Benign prostatic hyperplasia makes it difficult for urine to pass through the urethra. This condition is treatable, but you must follow a doctor's instructions to avoid side effects. There are several different surgical procedures to treat BPH. Some of these treatments are minimally invasive and use the transurethral method, which involves inserting a catheter or cystoscope into the prostate. During these procedures, water vapor is emitted through the needle or instrument, and the thermal energy released by the water destroys the problem tissue. Patients typically see improvement in their symptoms within 3 to 6 weeks after the procedure. How common is benign prostate enlargement? Benign prostate enlargement, also known as BPH, is a common condition that affects men of all ages. It can lead to urinary problems and can affect the kidneys and bladder. Treatment options range from medications and minimally invasive procedures to surgery. Your doctor will take into account your symptoms, the size of your prostate, and other health conditions before determining the best course of action for your situation. Benign prostate enlargement is a fairly common condition, affecting roughly 50% of men over age 50. The condition can lead to partial or complete obstruction of the urethra, resulting in difficulty urinating. Symptoms of BPH can range from slight discomfort to severe pain and inconvenience. Benign prostate enlargement is the result of an abnormal growth of prostate cells. It does not lead to prostate cancer. The symptoms of BPH include difficulty urination, weakness of the bladder, backflow of urine, and incontinence. How do you keep your prostate from enlarging? If you are wondering how to prevent benign prostate enlargement, you are not alone. Most men do not even realize they have enlarged prostates until they notice changes in their urination habits, or have difficulty passing urine. This condition is not cancerous, but it can cause many problems, including incontinence, urinary tract infections, and even bladder stones. BPH is usually not life-threatening, but it can affect a man's quality of life. Fortunately, BPH is treatable, and working with a doctor to find the right treatment can help prevent any serious complications. If you experience symptoms, call your doctor as soon as possible to get checked out. If your symptoms are mild to moderate, you may only need lifestyle changes and regular checkups. If your symptoms are severe, you may need surgery or medication. However, in many cases, lifestyle changes can provide relief from your symptoms and help you avoid further complications. How can you prevent a benign prostate? One of the most common health problems in men is benign prostate enlargement, or BPH. It affects nearly half of all men by the time they reach middle age. If left untreated, this condition can lead to urinary tract infections and even bladder stones. However, there are steps you can take to minimize your risk. For example, you should try to avoid caffeinated drinks and alcohol, which may change your bladder muscle tone and stimulate your kidneys to produce urine. These changes can lead to frequent urination and disrupt your sleep. Also, if you're taking medicines, you should check with your doctor about whether they make the condition worse. What causes benign prostate enlargement? The best way to tell whether you have benign prostate enlargement is to go to your GP for a checkup. There are several tests to do, including a digital rectal examination, DRE. Your GP may also prescribe a drug called an alpha blocker, which can reduce the size of the prostate and relieve symptoms. Alpha blockers work by relaxing the muscles in the bladder and making it easier for you to pass urine. Alpha blockers include tamsulosin and alfuzosin. Benign prostate enlargement isn't a dangerous condition, but it can affect your quality of life. However, the best way to deal with it is to work closely with your doctor to find the most effective treatment. If you develop any symptoms of BPH, call your doctor as soon as possible. Benign prostate enlargement is common in men over the age of 50. Symptoms of BPE include pain while urinating, difficulty urinating, and difficulty going to the toilet. It is a common condition that can be treated with medication and lifestyle changes. Can benign prostate enlargement be reversed? Benign prostate enlargement, or BPH, is a common condition that affects more than half of men over 40. This condition is a common source of discomfort for men, but it can be treated with non-surgical treatments that may help alleviate symptoms and restore normal urine flow. While some men will experience no symptoms at all, more severe BPH symptoms can lead to more discomfort and disruption of daily life. One type of surgery is called transurethral resection, TUSD, which removes a large portion of the prostate with minimal or no blood loss. The procedure is performed using local anesthesia, and requires no incisions. Patients typically recover from this procedure in 1 day. Although the procedure involves some risk of side effects, it can still be an effective treatment for BPH. Another non-surgical treatment for BPH is prostatic artery embolism. This procedure decreases the blood supply to the prostate through a catheter. The procedure is less invasive than other procedures, which means you can return to your normal lifestyle sooner and avoid the risks of sexual side effects and erectile dysfunction.